ACE inhibitor drugs. These are drugs from the vasodilation drug type. So they're used to increase the size of the blood vessels, to vasodilate them. And ACE inhibitor drugs, that means angiotensin converting enzyme inhibitor drugs. So they are inhibiting or blocking, stopping, halting that the angiotensin converting enzyme is doing its job. Normally, if the blood pressure is falling, then the kidneys are releasing renin. And that renin is then converting angiotensinogene into angiotensin 1, which is the inactive form. And here that thing comes, that angiotensin converting enzyme, which is inhibited through the drugs, which is converting the angiotensin 1, the inactive form, into the active form angiotensin 2, which then causes the blood vessels to constrict, which is inhibited that it is converted in the first place into it, and the blood vessels are not constricted, and where the blood vessels stay bigger, so vasodilation drug, the blood vessels getting bigger, because they're bigger, there's less pressure, less blood pressure. These ACE inhibitor drugs are used against heart failure, for example, or against hypertension, so high blood pressure, or diabetic neuropathy. Neuropathy is diseases of kidneys. And these angiotensin 2, that would also act on the adrenal cortex, the outer part of the adrenal glands, to release aldosterone, which are increasing the blood pressure, which is also not happening because the angiotensin 2 is never made. And they are often given together, these ACE inhibitor drugs, with diuretic drugs, and the diuretic drugs, they are there to get excess water out of the body, and together with beta blocker drugs. The sympathetic nervous system is giving out at its nerve endings the called beta receptors, noradrenaline, and these noradrenaline are making the blood vessels to constrict, so that is also not happening. And also these noradrenaline are also released by the medulla, which is the central part of the adrenal cortex. And this is so ACE inhibitor drugs, they are inhibiting that the angiotensin converting enzyme is converting angiotensin 1 into the active form angiotensin 2, which would cause the blood vessels to get smaller. And that is inhibited. And that is according to the Illustrated Medical Dictionary written by Stuart Davidson, Penny Prest, and Francis Williams. The main article is on page 7, but of course on several other ones as well. But this is now medical advice and also now substitute for medical knowledge. Hi and welcome. I'm trying to learn medicine today, ACE inhibitor drugs. And after we've done it, we're going to do squatter training. And if you participate in the squatter training, then it's at your own risk. And this is part 3, I think. So ACE inhibitor drugs. These are a group of vasodilator drugs. So when I say vasodilation, that is the increase in the size of the blood vessels. So vasodilator drugs are for increasing the size of the blood vessels. Let's take one look there, because a group of drugs that widen blood vessels. But what we describe here of the ACE inhibitor drugs, nothing of that is widening the blood vessels. It is just preventing or inhibiting them from getting narrowed. Vasodilator drugs are there to have bigger vessels. Okay, vasodilator drugs, and they're used to treat heart failure and hypertension, so too high blood pressure or too big a blood pressure, and also diabetic neuropathy. Neuropathy is everything around bad at the kidneys. And these ACE inhibitor drugs are acting on the angiotensin converting enzyme, so ACE, angiotensin converter enzyme. And if the blood pressure is falling, then the kidneys are releasing renin, and renin, where is coming the angiotensin from? Renin, an enzyme involved in regulation of blood pressure. When the blood pressure falls, the kidneys release renin, which changes a substance called angiotensin. Okay, angiotensinogene. Okay, the kidneys are releasing renin, and the renin is then changing the angiotensinogene into angiotensin 1, which is the inactive form of angiotensin. And when the angiotensin converting enzyme converts this inactive form, angiotensin 1, into angiotensin 2, and now that is narrowing the small blood vessels. and also acting onto the outer part of the adrenal glands. I don't know what it's called. The adrenal cortex, the adrenal gland cortex of the adrenal glands to release aldosterone. Which increases the blood pressure. And what was who doing? Aldosterone. That was who doing? That was the angiotensin 2. Angiotensin 2 is narrowing the small blood vessels and stimulating the release of aldosterone from the adrenal cortex, from the adrenal cortex. Just adrenal, same word. Adrenal gland, adrenal cortex, from the adrenal cortex, which is increasing the blood pressure. And they're given often together with diuretic drugs. They are there to get excess water out of blood, is written in the introductory sentence, and with beta blocker drugs. The sympathetic nervous system is giving off at its beta receptors at the nerve endings at the end, the noradrenaline, and they are causing certain blood vessels to narrow. And that would be when that. And these noradrenaline are also released by the medulla, which is the center, is written, of the adrenal gland. So we're having there the adrenal cortex on the outside releasing aldosterone, increasing blood pressure, and the medulla, the central part of the adrenal gland, releasing noradrenaline, which are constricting or making smaller certain blood vessels. Okay, I think we have it. I'm going to stop the camera and let's look at the evidence. Take one look at noradrenaline. And by the medulla of the adrenal glands. Noradrenaline are also released by the medulla center of the adrenal glands. But here's not written if it has something to do with ACE inhibitor drugs. Angiotensin converting enzyme. Angiotensin converting enzyme inhibitor drugs. Inhibitor means to stop them or to hamper them or to bring them down. So the angiotensin converting enzyme is through this angiotensin converter enzyme inhibitor drugs made smaller, or ACE inhibitor drugs. Now they are a group of vasodilation drugs and some medicamentation, and vasodilation drugs are used to make the blood vessels bigger. And they are used against heart failure and against diabetic neuropathy that is all bad at the kidneys, and also against hypertension, so high blood pressure. So vasodilation, making the blood vessels bigger, and when the blood pressure is low because there's no room. And they are doing the following, how it works. If the blood pressure falls, then the kidneys are releasing renin, which is converting angiotensinogen into angiotensin 1, which is the inactive form of angiotensin. And now the angiotensin converting enzyme, which these drugs are inhibiting, are converting angiotensin 1 into angiotensin 2, the active form. And this active form, that is causing the smaller blood vessels to narrow. And I just want to know, what was the other thing? There was something else. The outer part. The adrenal cortex is releasing aldosterone. Aldosterone. Angiotensin converting enzyme inhibitor drugs. So the ACE, the angiotensin converting enzyme, is inhibited, so it's stopped, hampered, brought down, made not so stark drugs with these medications. And they are used against heart failure and hypertension, so high blood pressure, and diabetic neuropathy. Neuropathy is everything bad with the kidneys. And they are a group of vasodilator drugs. Vasodilator drugs are there to widen the blood vessels. And normally it works like that if the blood pressure is falling, the kidneys are releasing renin, which is converting the angiotensinogen into angiotensin 1, which is the inactive form of angiotensin. And the angiotensin converting enzyme, which is inhibited through these drugs, is now converting the inactive form angiotensin 1 into angiotensin 2. And angiotensin 2 acts on the blood vessels, so it makes then the smaller blood vessels smaller. And if they're smaller, then the blood pressure increases because there's less room. And they are inhibiting that angiotensin converting enzyme to make that second form angiotensin 2, which would make it smaller and increases the blood pressure, because they should not do that. They vasodilator drugs, they should make them wider. And also these angiotensin 2 acts on the adrenal cortex, the outer part of the adrenal glands, to release aldosterone. And what are they doing? I just personally want to know it. I could just ignore it and say the other things, but just increasing blood pressure. Increasing blood pressure. Okay, just because I'm going to stop there again, what is the next thing we're going to say then? They're given together with diuretic drugs and the beta blockers. And the beta blockers. And these beta blockers, there were two things. This is, I want to say both. I have it both, so why not just say both? Even if it takes a double amount of takes or works. So the sympathetic nervous system is releasing with its beta receptors, the noradrenaline, and also would be released through the medulla. That has maybe not something to do with it, but the medulla, the central part of the adrenal glands. So aldosterone are just increasing the blood pressure. Angiotensin converting enzyme inhibitor drugs. So these drugs are inhibiting, so stopping or hindering the angiotensin converting enzyme ACE to convert angiotensin 1 into angiotensin 2. That is what we're doing, and we're doing that because they are vasodilator drugs. These drugs are used to make the blood vessels bigger. That makes the blood pressure lower because there's more room. And they are used against heart failure and hypertension if the blood pressure is too big, so making the blood vessels bigger, and also against diabetic neuropathy. Neuropathy is everything bad with the kidneys. And it works like that. If the blood pressure is falling, then the kidneys are releasing renin. And renin makes then the aldosterone. Aldostenoid. We're going to stop here. And I think we're going to do it actually in the next take, because we don't have time left. It was aldosterone, but it would have been written under the renin. Angiotensinogen. Angiotensinogen. Okay, we don't have time. I'm going to stop the cassette again. And we're going to do it in the next part. That means if you were here for medicine, you can go directly to the next part of medicine. We're having a multiple subject directly together, so it is It's not probably really never take for it. So if you were here for medicine, you can go directly to the next part of medicine. This was not medical advice, I was just reading it and trying to puzzle it together. What was written there. And if you stay here and participate in the squat training with the specialty harness, one leg up. And the other. Take the other leg again at the ankle. Tuck the tailbone. Change. Tuck the tailbone in. One leg to the side. The toes are pointing in front and we're stretching the inner side of the leg. And over to the other side. And go from side to side. And back into the middle. And now to the squats. Legs wide apart, and we're doing 12 squats. Number 1 and 2, 3 and 4, 5, 6 and 7 and 8, 9 and 10, and the last 2, 11 and 12. Now the 6-back squat squeeze. Quarter squat, press against the top part of the leg. Other side. Half squat, press in the middle of the leg. Other side. 3/4 squat, press close to the knee. Other side. And we're going directly over to the next exercise. Press against the knee, go towards it. Press against the knee, go towards it. Press, go towards it. Press, go towards it. Full squat, arms to the side. Over to one side, press against the leg, look up. Middle, over, press, look up. Middle, up. And now a bit stretching. One heel onto the ground, pull the toes in. Foot to the left, pull in. Right, pull in. Middle, and move from left to right. Other heel onto the ground, pull the toes in. To the right, pull in. Left, middle, move from left to right. One leg up. The other one. Take the leg at the ankle. Tuck the tailbone in. Change. And legs wide apart, breathing it down. In and up. And out. Breathe in and close the legs. And again out. That was the squat training. Thank you very much, and until next time.